Hey everyone, good day to all. Hope you guys are doing well. Hope you guys are preparing well for your FMG examination. So now, guys, you can ask your doubts, whatever doubt you're having regarding the FMG, what to carry, what not to do, and you can also share your preparation also. So let me know if I can boost your preparation. Okay. Hello. No one tested. Just raise your questions, guys. Okay, I will try to answer. I'm waiting for your questions. See, actually, for the examination, guys, what you have to carry. See, you have to go to a exam center before, actually, be on time. So you have to carry only your admit card. Admit card must be either in black and white or colored. Everything is fine. Okay, so uh, better to carry the colored only. Okay, apart from the admit card, you need to take one ID proof. That is the you have to take your passport, not the xerox of your passport. Okay, you have to carry your original passport. Okay, that is more than enough. Just two things are important. Okay, and also you can also wear the Crocs slippers. Okay, shoe also you can wear. Don't worry about that. Okay, since it's going to be winter season, so you can also wear the sweater also, but don't worry about that. They will check everything. Okay, while once you're going to before the exam room. Okay, so they will provide the water also before going to the exam room. Okay, didn't get any messages until now. I think hope you guys are preparing well for the exam, guys. Okay, so see, last it's going to be last 4 to 5 days only left for the exam. So what you have to do is that please just read your notes only. Okay, now learn, read, revise only your notes. Don't only revise your notes only. Okay, it's going to be very important. Just only revise. Please do not study any new topics. Okay, now because in this time studying new topic is like a poison. Okay, so this is what I did. One thing at last examination, I used to study a lot. Like until the day before the exam also, guys. I keep on studying. So when I went to exam hall, I saw that whatever questions came in the exam, all are from the PYTs only. PYTs, okay. So you have to be must and throw in the PYTs part. Do not lose any marks in the PYTs. No, out of 300 MCQs, almost 120 plus, almost 150 plus, all from the PYTs only. You know, the only new things like new MCQs will be asking from new topics. I think about only to 30 to 40 will come only from the new topics. remaining all are PYTs only. So you have to be very strong in the PYTs areas. Okay. No more questions. Chat number one. Chatting. No more questions. Seriously. It's okay. Guys, dogs are making noises. See, whatever 150 plus 150 plus topics I shared in YouTube channel and in the Telegram, guys, please try to study hard, okay? Because it's not going. This is not only the 150 plus. It's going to be there is 200 plus topics I give. You know, please try to study. Please try to master these, guys. You know, so I'm expecting more than 60 to 80 more than 60 to 80 MCQs from the topics from the PDF which I gave you. So okay, just expecting. Okay, I'm not sure that. So hello, first message I received from the prototype. Hello, Doctor Prototype. See, what are documents to be carried along with the admit card? See, along with the admit card, you must take your passport is enough. Okay, passport is more than enough. Carry your passport and the admit card. That's enough. No need Aadhaar card, no need the PAN card, no need anything. Just carry your passport. That's enough. Okay. For the safety purpose, you can also bring your Aadhaar card also. But if your passport, this is more than enough. Okay. Because last time also I bought Aadhaar card, PAN card, everything to the exam center, but they didn't ask anything. That's why you have to bring only your passport and admit card is not enough. Your admit card must be like a front and back. Okay, front side is your photo and the exam center, and the back side must be all the instructions what to carry, what not to carry in the everything is there in the admit card. Okay, now so front to back. That's it. I hope it's clear. Dr. Prototype. Any more questions? देखिए भाई लग वहाँ पढ़ के देखिए अंतिम है ना, ठीक है ना, तो अंतिम 4 से 5 दिन में आप लोगों को इतना बहुत डर लगेगा कि अरे यार मैं क्या कर रहा हूँ, क्या नहीं कर रहा हूँ। डर तो बहुत लगेगा कि मैं कर पाऊँ कि नहीं कर पाऊँगा, मैं निकालूँगा, नहीं निकाल पाऊँगा, बहुत डर लगेगा। बट यू हैव टू बी ऑलवेज़ हमको धैर्य से रहना है। यहाँ ऑलवेज़ बिलीव ऑन ऑन योरसेल्फ कि हाँ, मैं पढ़ा हूँ, मैं पढ़ा हूँ, मैं पढ़ा हूँ। अपने आप पर भरोसा रखिए, ठीक है? अपने आप पर भरोसा रखेंगे तो सब कुछ हो जाएगा। Any more doubts? I think no one responding here. It's okay. I came live after a long time. Okay, Dr. Harsh Kumar. Hello. Hello, doctor. How are you? Harsh Kumar. Harsh Kuwar. Okay, sorry. Harsh Kuwar. अरे भाई, होगा होगा देखिए। कोई भी हम लोग देखिए एंग्जियस होगा। कोई भी हम लोग लाइफ में, अगर हम लोग लाइफ में कुछ ऊंचा कदम बढ़ाते हैं तो हम लोग को सोचते हैं, बहुत सोचते हैं कि कैसा होगा, क्यों नहीं होगा। दैट्स लाइफ, दैट्स नॉर्मल साइंस। इफ़ यू आर, देखो आपको अगर एंग्जियस हो रहा है, देखिए आप फीलिंग नर्वसनेस, बहुत बहुत टेंशन ले रहे हैं, इसका मतलब है कि आपने अच्छे से पढ़ा लिखा है। ठीक है ना? सो दिया द साइंस एंड सिम्टम्स ऑफ symptom that you are going to pass. Okay na? Okay, see, if you studied well, then only you will get the anxiety, get more tense. You will be more tense about the exam, fear, because sometimes you may feel the dump, because oh my goodness, I don't know anything, even though you studied a lot. But sometimes you will feel that oh my goodness, I don't know anything about that one. GTs में आ रहा है 190. Oh my goodness, congrats bro. I'm pretty sure that you're going to get 200 plus. Mark my word, okay na? So after please don't forget to text me after the result. Harsh cover, you will get 200 plus. I'm pretty sure. Please, okay, ज़्यादा टेंशन मत लो भाई, हो जाएगा। ठीक है, बस जितना पढ़े हैं भाई उसी को कंटिन्यूअसली रीडिंग करते रहो। उसके बाद में क्या हो रहा है कि जीटीस में, ठीक है भाई, देखिए इसमें फर्स्ट पेपर सेकंड पेपर है, देखिए लाइक ऐसे नहीं होता है इसमें। देखिए अगर देख लिए, मान लीजिए कि मैं जब दिया था, जुलाई में दिया था, तो पेपर 1 बहुत ईज़ी आया था, तो पेपर 2 बहुत कष्ट आया था, ठीक है, कठिन आया था। तो इसमें क्या होता है कि आपको, फॉर एग्ज़ाम्पल देखिए कि आपको पार्ट 1 ही ज़्यादा हो गया था, इट मे बी द फर्स्ट पेपर इज़ गोइंग टू बी डिफिकल्ट। हो गया ना, समझ में आया ना? हमेशा ये नहीं कि पेपर 1 ही लाइक ईज़ी आता है, ठीक है? देखिए 2 पेपर आता है, 2 पेपर में से 1 पेपर आपको बहुत ईज़ी आता है। इट्स गोइंग टू बी लाइक ए वन वर्ड आंसर, ठीक है? तो एक फर्स्ट पेपर में यू कैन ईज़िली स्कोर अराउंड 100 प्लस स्कोर। आउट ऑफ 150 यू कैन ईज़िली स्कोर 100 प्लस स्कोर। तो भाई देखो, जो ईज़ी रहता है ना, ठीक है? सपोज़ एग्ज़ाम्पल क्या हुआ कि सपोज़ एग्ज़ाम्पल इन द मॉर्निंग सेशन यू विल गेट द ईज़ी पेपर। देन यू कैन, ओके, ओके ना? वही बोल रहा हूँ ना। सो सपोज़ एग्ज़ाम्पल यू गेट द मॉर्निंग टाइम में आपको आपको अच्छे से मिल गया पेपर में, तो यू कैन रॉक, you can score easily around 100 plus score out of 150. Don't worry about that. You have to work hard for the evening session, which is harder. ओके, सो ऐसा कुछ नहीं होता है भाई, ज़्यादा मत सोचो, ठीक है? सो देखो भाई, हर स्कोर देखो, सिंस यू आर टेलिंग दैट कि एनाटॉमी, बायोकेमिस्ट्री, फार्मेमी आर वेरी वीक, मुझे मालूम है कि तुम ना एनाटॉमी, बायोकेमिस्ट्री, फार्मा में पूरा फाड़ कर आओगे। देखिए, इसमें क्या होता है कि ना, देखिए क्या होता है कि मुझे भी लाइक कोई सब्जेक्ट रहता है, कोई सब्जेक्ट मुझे बहुत डाउट था, ठीक है ना? तो इसमें क्या हुआ, जो मुझको बहुत ज़्यादा कठिन था ना, उसी को मैं फाड़ कर आया था। उसी को मैं बहुत ज़्यादा अच्छे से कर कर आया था, ठीक है? देखो एनाटॉमी का अजाम सर का और क्या बोलते हैं शिल्पी मैम का, वो देख लो, इमेजेस देख लो। बायोकेमिस्ट्री का अजाम सर का देख लेना, वो लास्ट रीजन है। फार्मा का तो आपको रट्टा मारना ही पड़ेगा। मेरे चैनल में है, 100 क्वेश्चन है, वो देख लो। वेरी इजी भाई, डोंट वरी अबाउट दैट। फार्मा बहुत इजी आता है, सिर्फ एक लाइन में रहता है, बहुत इजी आसान हो जाता है। अनाटॉमी में इमेजेस, जॉइंट्स, फेरेंजियल आर्चेस, वो पढ़ लेना, ठीक है ना? भाई ज़्यादा देखो, ज़्यादा टेंशन मत लो भाई, ठीक है ना? जो ठीक है ना, जितना तुमको कठिन लगेगा ना, एग्जाम में एकदम मस्त लगेगा, ठीक है? इसीलिए ज़्यादा सोचो मत, सबके साथ होता है, ठीक है? जो ज़्यादा पढ़ता है ना, उसी को ऐसा होता है, उसका फीलिंग ऐसा होता है। इसका मतलब कि दे आर द साइंस एंड सिम्पटम्स दैट यू आर गोइंग टू रॉक। ओके, इट्स मोस्टली ईजियर देन, यस, जीटी से, ओके, प्रोटोटाइप जीटी से बहुत अच्छा इजी रहता है। ओके, जीटी से अच्छा रहता है, जीटी से इजी रहता है। बट उसमें क्या आता है भाई ना, देखो कि देखिए मैं 2 सेट्स आता है, एक सेट में तो बहुत ईजी आता है, इट्स लाइक ए वन लाइनर आता है, वन लाइनर्स। नेक्स्ट नेक्स्ट सेशन आता है जो इट्स लिटिल बिट हार्डर। इसमें क्या होता है कि 50% इज हार्डर, 50% वेरी इजी। सो दैट्स व्हाई यू हैव टू स्कोर मोर इन द फर्स्ट पेपर, इन द easier paper. Easy set में if you are going to score 110 plus, then you can easily score around 60 to 70 marks in the next paper. ओके ना, इतना कठिन नहीं रहता है कि हाँ कि चलो ऐसा है। देखो टोटल दे रहा है जो 250 150 आता है। ओके, 50 50 50, ओके, 50 50 मिनट्स, नेक्स्ट 50 50 मिनट्स, नेक्स्ट 50 50 मिनट्स, 3 रहता है ना। तो 3 में से आपको क्या होता है कि लाइक नेक्स्ट 50 हुआ, थोड़ा कठिन रहेगा, छोड़ दो। नेक्स्ट 50 इट विल वेरी इजी फॉर यू। ओके ना, 50 क्वेश्चंस में तो 50 नहीं, 50 भी विल नॉट बी टफ ना। 50 में से 25 इज इजी फॉर यू ना। देन व्हाई भाई, थोड़ा दिमाग से सोचो। ठीक है भाई हर्ष कुमार, ठीक है। देखो इतने आप लोग इतने मेहनत से पढ़े हैं, ठीक है। आप लोग अभी तक इतने इतने मेहनत से पढ़े लिखे हैं, बहुत बहुत किया, ठीक है। जो भी देखो, जो भी स्टूडेंट है अभी तक जितने मेहनत से किया है, अभी तक पढ़ा है ना भाई, बोल रहा हूँ रॉक कर देगा। ज़्यादा टेंशन मत लो भाई, ठीक है। एग्जाम तक पूरा एकदम अच्छे से, ठीक है, रहिए, खाइए पिए, क्या टेंशन मत लीजिए, ठीक है। एग्जाम लिखिए, एग्जाम के दिन भाई ना मजा आ जाएगा। देखो भाई, देखो एंग्जाइटी क्यों आ रहा है, देखो तुम क्या कर रहे हो कि अरे कैसा होगा, कैसा, वो नहीं सोचो, ठीक है। एक बार क्या करो कि देखो क्या बोल रहा है, देखना हर्ष कुमार, देखो एक बार सोचो कि हाँ मैंने क्या किया, मुझे क्यों, वाई हैव टू बी एंजाइटी, मुझे एंजाइटी क्यों आना चाहिए। देखो सोचो एक बार, ठीक है, कि ओके मैंने जीटी दिया, जीटी में मुझको इतना इतना नंबर आ रहा है, ठीक है, ओके, मैं सब कुछ अच्छे से पढ़ा हूँ, तो मुझे क्यों होना है ऐसा। थिंक करो एक बार अपने आप को, थिंक करो। देखो भाई, दूसरे देखो, नेवर कंपेयर विद अदर्स, नेवर एवर कंपेयर विद अदर स्टूडेंट्स कि अरे वो सालों को 200 आ रहा है, 230 आ रहा है, ऐसा कभी मत करना, ठीक है। अपने आप पे सोचो, थिंक अबाउट योर सेल्फ, ओके, वट एवर आई डिड विथ इन 6 months, ओके ना, बिलीव ऑन योर सेल्फ। Okay, I wrote every GT, okay, I got 180 170, डोंट माइंड, ओके। देखो ज़्यादा जीटी के स्कोर पर मत ध्यान रखो, ठीक है ना, ज़्यादा जीटी पर स्कोर पर मत ध्यान रखो। ये करो कि ओके हाँ मैं जीटी दिया हूँ, ठीक है, जीटी में से मैं कितना सीखा हूँ, जीटी में कितना सीखा हूँ, उसको वो रहता है, उस पर ख्याल रखो ज़्यादा, कि मुझे जीटी में 150 आया है, 140 आया है, ऐसा कुछ नहीं है। देखो जिसको जिसको जीटी में 90 आता है, 100 आता है ना, वो भी पास हो जाता है, ठीक है। तो वही बोल रहा हूँ ना कि बस अपने पर ध्यान रखो भाई, हो जाएगा, ठीक है। लैंग्वेज रहता है कि हाँ रहता है। देखो भाई, देखो कुछ नहीं है, देखो देखो लाइक पीवाई किस अपना पीवाई किस करते हो आप ना, पीवाई किस सेम ऐसे रहता है, पीवाई किस रहता है ना भाई, सेम वही स्टाइल का रहता है क्वेश्चंस वगैरह, बस, है ना। लैंग्वेज का ऐसा रहता है, या देखो क्यूरियस ट्रैवलर कितना उनको आ रहा है, कितना आ रहा था, 140 150 आया था, फाइनल कितना आया, 178 आया, डन। इसलिए भाई लोग देखो, देखो क्या बोलते हैं कि जीटी का स्कोर पर मत ध्यान रखो, ओके ना, जीटी का स्कोर पर मत ध्यान रखो भाई, ठीक है। जीटी में कभी कभी आपको 250 आएगा, कभी कभी 190 आएगा, उस पर मैं नहीं रखता है। देखो ना जीटी से कितना सीखे हो, ठीक है, कितना सीखा हूँ मैं, जीटी में कितना मिस्टेक्स किया हूँ, उसको सीखो, उसको सुधारो, मैं कितना मिस्टेक्स किया हूँ, है ना? जितना मिस्टेक करोगे उतना सीखोगे। तो प्लीज़ ओके कि सोचोगे कि मैं जीटी में 130 आया, 140 आया है, हार मान जाओगे। ऐसा नहीं करना है। जीटी में जितना जितना कम आए, उतना तुमको सीखना है तुमको। मैंने गलती कहाँ किया, वहाँ पे सुधारो। ओके? हुँ। नेक्स्ट वन सर हाउ कैन वी कंपेयर जीटी लेवल ओके जीटी सर हाउ कैन वी कंपेयर जीटी लेवल एंड एग्जाम इस एग्जाम विल बी वेरी इजी इजी यार बहुत इजी रहता है देखो पार्ट वन पार्ट टू रहता है ना पार्ट वन एंड पार्ट टू सी इधर पार्ट वन और पार्ट टू इज गोइंग टू वेरी इजी फॉर यू गाइस out of 150 guys you can usually score 100 plus score in the part 1 or part 2 ना and the next part is going to be little bit harder but like देखो आप लोग क्या करते हैं कि दिमाग में बैठा लेते हैं कि यस कि हाँ हार्ड रहेगा घंटा ఓకేనా మనం అనుకుంటాం మనమే అనుకుంటాం అన్ని అరే कष्टम रहेगा नो ऐसा नहीं करना है ओकेना और कितना क्वेश्चंस ऐसा रहता है कि आराम से हो देखो भाई क्वेश्चन देखो 300 में से ओके ना 300 में से क्वेश्चंस में आपको इजीली आराम से अराउंड 60 टू 70 क्वेश्चंस ओके ना 60 टू 70 क्वेश्चंस लाइक वन लाइनर आता है आराम से कर लोगे ओके 60 टू 70 क्वेश्चंस आराम से कर लोगे ठीक है నా పేపర్ ఎలా వస్తుంది అని అనుకుంటున్నా ఈసారి ఈసారి పేపర్ గట్టిగా ఉంటదిరా గట్టిగా ఉండదు అంటే చాలా ఈజీగా ఉంటది ఎందుకంటే అంటే నీకు తెలిసిందే పార్ట్ 1 గాని, పార్ట్ 2 గాని ఈజీగా ఉంటది కాబట్టి ఎట్లాగో వదిలేయి. పార్ట్ 2 కూడా ఈసారి లాస్ట్ టైమ్ కొంచెం తొక్కాడు గానీ, ఈసారి అయితే అంటే లాస్ట్ టైమ్ మనకి ఎక్స్‌పెక్ట్ టాపిక్స్ రాలేదనమాట. కాబట్టి ఈసారి ఆ ఎక్స్‌పెక్ట్ టాపిక్స్ రావచ్చనమాట. ఎక్స్‌పెక్ట్ టాపిక్స్ ఈసారి రావచ్చు. కాబట్టి ఈసారి పేపర్ మాత్రం మంచిగుంటది. బానే ఉంటదిరా. ఓకేనా. మరేం చేస్తామంటే ఎక్కువగా మనం క్వెషన్స్ చదవంరా అరేయ్! See in the FMGE paper guys, what you have to do is that please focus on you guys are not studying the question properly. This is the mistake you are doing. See, okay, see हम लोग क्या करते हैं see in the FMG exam guys, in the exam hall guys, we are not going to see the mistakes students are doing is that they're not studying the questions carefully. Okay, if they ask you suppose example they ask you uh, which all of the following are acidic acidic amino acids. That's it. They are not studying the except all not ending one. अरे भाई क्वेश्चन तो पूरा पढ़ो पहले. Please try to study the questions carefully, guys. Okay, na? If they ask you, okay, barium, okay, there is a bird big sign, okay, bird big sign, barium enema. You guys are marking, okay, aclasia cardia. What? Bird big sign is a swallow, okay, na? Swallow, barium swallow. You see the what? Aclasia cardia. But the barium enema, you have to see where? Barium enema, bird big sign. Actual answer is what? Sigmoid volvulus. In the sigmoid volvulus, you'll see the what? Bird big sign. By what contrast? Barium enema. But you guys are simply marking, okay, aclasia cardia. Hey, no, it's not like this. You have to read the paper, read the questions carefully. You have to avoid doing this mistake. So see, okay, now you have to know how to rule out the questions answers. You have to be clear about this, Ra. It doesn't matter that how much you studied. Okay, if you don't know these skills, obviously, 100% you're going to mark the wrong answer. So you have to be very focused. Okay, now please try to study the question paper until the end. The magic in the question is in the last word. You have to read the first line and the last line. If they are mentioning anything, if they are mentioning particularly the age, or female, male or female, it means they are asking about any specific diseases. Okay na? Okay na? You have to like this ra. See, in the last exam also, in July exam, for me, I it's my overconfidence ra. Okay na? I wrong, I marked up to 20 questions. This is my bad luck. Without studying the questions only. This is, I did my mistake. So you have to be focused. Okay. See, at this point, guys, at this point, you have to please try to revise your notes only. Okay, na? Okay, na? Revise only your notes. Whatever is studied until now, do not don't try to study the new topics. Please try to revise your notes only. Okay, na? That is more than enough. Okay, at the from the morning to evening, try to revise your notes. At night time, please solve the MCQs. Okay, na? See, guys, I for me, guys, see, from the see, MCQs का solve करने के लिए you have in the FMG solution. FMG solutions, guys, especially for the minors. See, radiology, orthopedic, anesthesia, और क्या बोलते हैं कि ये सब है ना. इसमें क्या होता है देखो, इसमें क्या होता है कि all the questions, okay, all the questions are the way of asking the questions. Question language is same, is going to be same. If you are going to solve the questions properly from the FMG solution, guys, especially the minus one. See the radiology. If you are going to open the radiology FMG solutions now, it's the same line, the same questions is going to ask in the exam also. Same is came ra. Just try to study that one, ra, babu. Okay. For the only minus, please follow the FMG solutions and please solve every questions. Okay, na? Can I tell you one thing, guys? In the last July examination, guys, I think the all the papers, all the questions, the language, question language, and the question papers is came from the 2018, 2018, 19 FNG papers. Okay, because you know how I know that, because whenever I'm going to, I seen you guys know that I'm preparing the question paper for my the GTs, and also the posting the MCQs in my Telegram channels. That time I realized that, oh my goodness, all the questions are came from the 2018 July. Oh my goodness. So guys, see guys, for the FMG, guys, you have to please try to study the 2018, 19, 20, 21. Okay, these papers, and also the last July and January paper. Okay, na? 2018, 19, 20, 21, 4 years paper. Please try to study, and also please try to study the NEET last time. Okay, last year NEET and the initial paper. Please do not study only the MCQs, guys. Okay, na? Try to study the topics. Okay, na? Please take note down the all the topics which are asked in the NEET PG and the inset. Okay, focus on the topic. Focus on the topic. Do not focus on the MCQs. Okay, na? Do not focus on the MCQs. Okay, focus on the topics. Okay, na? See, sir, I have not done it. What happens here? For the pharmacology, guys, you can just try to read my 100 plus 100 plus. There is a 100 plus one liners in my channel. Okay, na? Please try to read that one, pharmacology. There is 150 plus. Don't worry about that. I am planning to take one session for the pharmacology, guys, on the 10th evening. Okay, na? Don't worry about that. See, pharmacology is very easy, ra. Don't worry about that. Okay, na? See from the pharmacology, see anticholinergic and cholinergic and anticholinergic will get one MCQ. So I think everyone knows about the what do you call that, myasthenia gravis. Myasthenia gravis. There is one question is that what is the single most sensitive test? Okay, na? Most sensitive test is the what? Single fiber EMG, means electromyography. The most sensitive test is what? single fiber electromyography. See, if they ask you what is the diagnostic test, what is the diagnostic test means you have to mark hydrophonium. You have to mark hydrophonium or tensilon test. See, you guys are see last exam what happened is that they asked that what is the single most sensitive test. Okay, hydrophonium. Done. They what ra? Try to study the question ra. What they asked. The question is that the most sensitive test. What is the single fiber electromyography? If they ask the no. It is not. See here. Estrogen antibody it is specific. See sensitive is the single fiber EMG, but the specific is the estradiol antibodies. Her score. Okay na. Sensitive is the single fiber EMG. Specific is the okay estradiol antibodies. For the diagnostic is the what you have to do the hydrophonium. While giving the tensil hydrophonia injection, guys, the symptoms will be improved. For that one, you are going you are giving the hydrophonium. Okay, see here. What is the okay here? There is a one form of question here. What is the drug of choice for the myasthenia gravis? It is the pyridostigmine. The pyridostigmine. Why we are giving the pyridostigmine? Because it doesn't causes the blood-brain barrier. If there is see, if there is no pyridostigmine in the option, then what you are going to mark? What to mark the neostigmine? Okay na? Okay na? You are mark the neostigmine for the neostigmine. What is the treatment of choice? It is the thymectomy. What is the thymectomy for the myasthenia gravis? See, simple question. Okay. Sometimes they will ask. I'm going to ask the see what is the like this one. Okay. See from the cholinergic anticholinergic guys going to be very easy question guys. You will get the 2 to 3 MCQs. Please follow that one. Okay. Okay. From the pharmacology guys, and also please try to learn the side effects of the lithium and the amiodarone. Okay, and also from the topic of from the Parkinson and Alzheimer's disease, guys, you will get the one MCQ. And see for the what is the drug of choice for the Alzheimer's? It is the what drug of choice for Alzheimer's is the donepezil. It is donepezil. See, we are having the donepezil. Okay, rivastigmine, galantamine, memantine. The best option is the what? Is that donepezil. Donepezil is the drug of choice for the Alzheimer's. If they ask you what the patch is the what for the rivastigmine. It is the patches. Patches is the for the rivastigmine. Okay, na? When you have to give the memantine you have to give it is a NMDA antagonist. So you have to give the memantine when it's going to be the serious condition. Serious condition you have to give the memantine for the Alzheimer's. So here for the Parkinson, what you have to do? For the Parkinson, you have to give levodopa plus carbidopa. See, levodopa plus carbidopa. They are like a true love. Okay, na? Lovebirds. They are true lovebirds. They have to be there. They will work together. Okay, na? So you have to give carbidopa and the levodopa. So like this, see, you have to go systemize. You have to go systemize, guys. It's going to be very easy for the very easy form. Next, coming to thyroid also. Okay, so is the thyroid? What is the in the pregnancy? PTU. Okay, so in the first trimester, second trimester, what you have to do? Like this, you have to study everything from the pharmacology, guys. Systemize. Okay, revise. Pharmacology is going to be very easy, guys. Don't worry about that. From the antidotes, you will get one MCQ. Have you guys studied about the all the poisons, all the poisoning? We are having the datura poisoning. All 8 Ds are the datura poisoning. Opium poisoning. Opium withdrawal. See, opium withdrawal. Opium withdrawal means what? Withdrawal means what is that? You are in the anning, you are in the what, salivation, lacrimation. It is for the opium withdrawal. Yes, there is a thallium poisoning. We have thallium poisoning. There is a alopecia and there is a madrosis. There is a botonial line here. What is the case? It is the case of lead poisoning. Okay, na? Some things run amok, morphine. Okay, there is a like someone is seeing red colors in while listening to FM radio. Okay, it's going to the LSD poisoning. There is a okay, there is a fentanyl, amphetamine. Okay, there's a amphetamine poisoning. Okay, it is called a liquid cold, because the amphetamine is not going to change the urine. That's why the body packers, they're going to drink the amphetamine, and since the it's not going to dissolve into the urine, they'll just collect it from there. It's called a urine liquid, case of the amphetamine. Okay, so these are the important poisonings, guys. You have to remember from that one. There is a there is one poisoning called as, which is similar to the what, similar to the tetanus. It is the strychnine poisoning. Strychnine poisoning. So these are the poisons, guys. Okay, there is a cocaine. This is also called a what, formication. It's okay, bugs, cocaine bugs. What, remember this poisoning, guys. From this one we will got one MCQ. Hmm? You have to remember the all the types of cataracts here. Cataracts is going to be very important for you guys. Okay, cataract, they will give you the images. And also you have to remember the conjunctivitis, viral, it is called reticulars, viral. Okay, green color. This is what, is the green color discharge. It is what, it is the bacterial diseases. Fungal, there is a satellite like. There is a shield ulcer like a ring ulcer. You'll see in the acanthamoeba. Yes, important. So you must thorough mainly, especially on these topics, guys. What are the must known topics? You must thorough. Okay, na? You are not allowed. You're not allowed to miss the one MCQ from the PY test, guys. Okay, na? PY test जान है. Okay, ना, यही आप लोग को बचा सकता है. You must thorough. Okay, see in the anatomy, guys. In the anatomy part, guys, you will get the one MCQ from the joint. Mostly they are going to ask the from the cartilage joint, either this is primary or secondary. Primary or secondary joints. Primary is in where, hmm, diaphysis and epiphysis. Secondary is in the middle. Then from the there I will get from the saddle joint, ball and socket joint, syndesmosis. Okay, these are the one MCQ areas. Joint one MCQ, and you will get one MCQ from the planes here, intercostal planes here, subcostal planes. From that one, you will get one MCQ. Either this or either pharyngeal pouches, fifth pouch, sixth pouch, fourth pouch, third, first, second, arches. You get one MCQ from there. See, all time they are going to ask alternatively. If they are not going to ask the planes, okay, then they are going to ask from the pouches. If not pouches, they are going to ask from the planes. Two MCQs from here. And one MCQ from the what? One MCQ from the radial nerve injury. See, not radial, there is a upper nerve injury. Upper limb. See, mostly they are going to ask from the winging of scapula. Winging of scapula. What nerve? Long thoracic nerve. Long thoracic nerve. What muscle paralyzed? Serratus anterior. Okay, serratus anterior muscle. What border? Medial border. And also see here we having the Op's palsy and the Klumpke's palsy here. Op's palsy, Klumpke's palsy. Okay, Op's palsy C5, C6. Op's palsy due to what? Due to shoulder dystocia. Okay, there is a, like this one. There is a what? Polish tip, hand tip. We have in the Klumpke's palsy. See, Klumpke's, Klumpke's, means It is means, see in the Klumpke's palsy, what happens? You have to remember means Only the ulnar and median are involved. Only the ulnar and median nerve is involved in the case of the Klumpke's palsy. Plum, means um. See, in the Klumpke's palsy, we have in the ulnar and median nerve is only involved in the Klumpke's palsy, and the rest is you have to throw in the where throw in the Op's palsy. See, it's very simple. You have the complete hand done. What the? You have to see if they ask the from the there is a sensory loss from the lateral part of the arm is the what muscle contains no foot drop, hand drop, finger drop. Then from there we'll get one MCQ. Okay, and from the brain part from the neuroanatomy we'll get the one question. You have to identify which is the internal capsule, thalamus, putamen. Okay, either that one or else you can get the you can get the okay. See, or else you can get the MCQ from the circular villus. Okay, anterior communicating, posterior communicating, vertebral, basilar. Oh, okay, vertebral, basilar, and okay, posterior cerebral artery, middle cerebral artery, anterior cerebral artery communicating. Okay, now they may ask the which of the folly is not a part of the circular villus. Like this only. Very very simple. Okay, here the question is the how to revise the medicine. See here, medicine guys. Here, medicine means what? Medicine means what? Medicine is a combination of what? Combination of all the subjects. Medicine is a combination of all the subjects. So if you are thorough in all the subjects, then medicine is going to be very easy for you guys. See, I can tell you that from the see medicine. Please take note. Medicine neuropart guys. Okay, medicine neuropart guys. Always, you first of all you have to know the types of headache. Okay, types of headache is important. Types of headache is important. First of all, types of headache will get the one MCQ from the types of headache. We're having what? We're having the tension type headache, cluster headache, migraine headache. See, for the migraine headache, guys, you can see that there is a what? There is a increase in what? Increase in CGRP. Increase in the CGRP in the migraine. That's why you can feel the here pulsatile. Here the pulse. Okay, we feel the okay na. So can you tell me here, please listen carefully for the migraine headache, guys. What is the treatment in the severe to moderate to severe? You have to use the sumatriptan. You have to use the sumatriptan. Remember one thing here. Sumatriptan is contraindicated. What is contraindicated in what? Contraindicated in the case of stroke and the heart diseases. Stroke and the heart diseases, it is highly contraindicated. You have to stop giving the sumatriptan. Okay now. And also see here for the C, for the what is the prophylaxis you have to give what? For the prophylaxis you have to give the propranolol. Remember one thing here, if the patient is obese and the patient is having the migraine, you have to give what? You have to give the topiramate. Okay, you have to give the topiramate for the migraine. Please remember this one, guys. Okay, na? Because all time they are going to confuse you guys from these topics. From the cluster headache, you have to, what is that? What is the treatment? Is the sumatriptan, and also you can give the high flow oxygen. And then next is from the CSF. CSF, I think everyone knows about that. How to differentiate between the viral, bacterial, fungal, viral. Okay, na? TB meningitis. See in the what the hallmarks in the TB meningitis is that in TB meningitis what happened here? What happened? There is a high. There is a maximum what? There is going to maximum protein there. Maximum protein there. That's why what happened there, they're going to be maximum protein. They are going to form what? They're going to form the cobweb. They are going to form the spider like web there. Okay, now they're going to spider like web that's called as cobweb formation in the case of the TB meningitis. Very simple. Remember the viral normal. See, in the case of viral, everything is normal there except what? Except lymphocytes. Lymphocytes is only going to be rising. In the case of viral, coming to the bacterial, guys. See, as you know that bacteria loves to eat what glucose. That's why in the bacterial and TB, what happens? The glucose will be what decreases. Simple. So in the bacterial gas, what is there? There is a what? There is a something called as there is a high PMN or neutrophil cells. That's enough. And also from the medicine neuro, you will get the M1 and C from the stroke. Where how you are going to manage the stroke there? ABCD score stroke there. And also remember the neuro in your upper neuro, upper motor neuron and the lower motor neuron defects. More than enough from the neuromedicine. From the GIT medicine, guys, as you know about there is a Mallory-Weiss syndrome and the Mallory-Weiss, and there is a what is there Boerhaave syndrome. Everything. See, medicine is also like see, if you are in the surgery part, guys, if you are going to if you are going to study that thoroughly the surgery part, then also the medicine part is also going to be easy for you guys. Okay, na? See, medicine is means what is the combination of all the subjects, so it's going to be very easy. See, in the from the cardiology, guys, you have to remember the what? You have to remember the PSVT. What is the? It is adenosine PSVT. First of all, you have to do the what? You have to do the carotid massage. Carotid massage. Okay. If the patient is unconscious, you have to give the cardio version. PSVT, VT, ventricular tachycardia. Remember the graph. Osborne wave. That is what? Hypothermia. Okay. Delta wave. And also atrial flutter. Okay, na? And also please remember the types of the heart block also. That's the heart block. And remember the types of angina. Okay, now you have to remember the in what cases you have to contraindicate is going to in what cases you have to not give the thrombolysis. Remember the STEMI and STEMI. Remember the acute rheumatic fever. More than enough from the what from the cardiology, guys. Hmm. Ante. That's it from it. See, medicine is very easy, guys. Okay, this is how you have to revise. You have to always integrate. Okay, na? It's going to be always integrated. You have to always study like a integrated. Yes, application form. Dr. Aravindan. Don't worry, I will. I'm trying my best to explain all the important topics on the 10th evening. I will try to come on live, but I don't know. I don't know about the technicals here. So I will try to so that I can share the manage stream here, channel setting. I don't know. Okay, oh, there is screen share here. Oh my goodness. Wait lang. Okay, okay. There is screen share also, na? Okay, okay. So sorry. Okay. Mm-hmm. Hope this is visible. I think this is visible. Let me confirm once so that I can revise. Oh my goodness, very easy here. 1 minute. Yes, you can please. It's not visible. My screen is not visible. Wait, wait. My screen not visible to you. Wait, wait. Something happened here. Stop sliding. Okay, done, done. Okay, okay. So here, see, Doctor. Okay, I mistakenly wrote 2023 instead of to June 2025. I have applied for session. It's okay. So, Doctor Aravind, see here. Actually, they can easily come to know about that. When did you wrote the last exam? Don't worry about that. When they open your profile, they can everything knows about that one. So, guys, this is my Telegram group. Oh my goodness. So, guys, this is my. You can join there to get the all the updates regarding the FMG, and there I've also got what call it the for the quizzes everything. So okay, tomorrow I will try to do everything. Tomorrow I will try to revise everything. You can see here, guys, this is the one. This is the case. Last time in the July examination they asked this one. This is the case. What happens is here that they told that actually they didn't mention they mentioned this image. They didn't give in this image, but they told that there is a yellowish nodule in the question. Okay, there is a yellowish nodule. It means you have to remember that it is they are going to ask about the flectular conjunctivitis. They are asking about the flectular conjunctivitis. Remember here, this is the cobblestone pattern. This is the cobblestone. This is cobblestone appearance here. Cobblestone appearance. It means they're going to asking about the VKC. So for the VKC, they are always they're going to give the history of the itching, ropey discharge, and more in summer here. Can you tell me this is the combustion appearance also seen in the case of Crohn's disease. C for cobblestone, and C for what? C for Crohn's disease. The Crohn's disease. Remember, this is the spring catarrh, also called as spring catarrh. See here, this is going to be this is the giant papillary. This is the giant papillary conjunctivitis here. Giant papillary conjunctivitis here. See, for this one, guys, they will give the history of there is a using contact lenses. History of using contact lenses. Bro, I have doubts. Okay, Dr. Duwag Rakshan. I'm doing clerkship now. I have no idea about how to start preparation. Um, See here, Dr. Duwag Rakshan. Actually, what happened here is that while you are doing the clerkship, what you have to do is that whatever rotation you are going to you are going to rotate in the every department now. So please try to cover the at least 20 to 30% of the exam, 20 to 30% of the topics. For example, if you're going to rotate in the pediatric department, so at least you can search in the YouTube also what to study about the pediatrics in the FMG. So just try to take note that all the important point topics from the pediatric, and please try to cover it from the YouTube, guys. YouTube. Okay, na? You can also tell me. You can also please once DM me in my Telegram. This is my Telegram user ID, Doctor Duvar Rakshan. So I can also I will guide you. Don't worry about that one. It's omeprazole 40 milligram. It's okay, yeah. So tomorrow I will continue everything. It's okay, guys. Tomorrow I will be continue. I will continue everything. So let's rock tomorrow. Okay, na? Tomorrow I will plan. So let's tomorrow I will do all the revision at a time. Okay. So please tomorrow after 9:30 p.m. I will start the revision of the all the 19 subjects. Okay, let's see. It's going to be around up to 4 to 5 hours. It will take 4 to 5 hours. Okay, to complete all the 19 subjects. Please stay with me. Not tomorrow. At the 10th. Okay, 10th, 10th of this John. I'm going to plan. I'm planning to do the all the 19 subjects revision session. Okay, na. The work action. Please once DM me in the Telegram chat. So guys, thank you very much. If you have questions, please try to don't try to chat with me. Okay, now please always feel free to chat with me. Please feel free to chat with me, guys. Okay. So okay, I will see you guys on the 10th of this January after 9:30 p.m. Okay. So let's devise all the important topics of the hot topics from the FMG, guys. So I can pretty sure that we'll get the around up to 50 to 60 MCQs from my slides. Okay. Okay, now. So any more questions here? Any more questions? See, the work action question. See, so this is the same question most of the guys are asking me. Actually, while I am in clerkship, I used to study like this only. Actually, I maintained one book for the whole clerkship. Suppose example, I'm going to rotate in the surgery department. So I always try to learn the cases which I when I'm going to hospital, but whatever cases I used to see, just I'm going to read about the cases, and what actually you have to read in the surgery, guys. So just try to once see open the YouTube and search there. You get the all the high yield topics in from the surgery. You have to just take note the all the important topics and just try to read that one. Okay, now see, guys, see here, that option here. See, until your graduation, try to do like this only. Okay, try to do like this only. So after, see, if you're going to take any online, so if you're going to take any subscription, okay, na. So guys, for the subscription, according to me, it's going to waste of time right now, because you know what happened, is all recorded only. So you are not you may not get the you may not get the time to study also, I think. I do know that one. See, it's hardly you're going to get the free time up to 3 to 4 hours. So you have to take rest. So please follow like this only. Follow like this only. So after your graduation, after coming to India, you can take anything like any online or only online or offline session for the preparation for your preparation. Okay, it's going to be more than enough to crack the FMG. Okay, see, I did like this only. So my FMG, uh I spent total only 15,000 rupees for the my FMG. That's it. I didn't take any subscription while in the MBBS days. After graduation only, I came here and just wrote everything. Okay, so that's it from my side, guys. I will see you on the 10th of this January. Okay, so that we can revise all the important topics. Okay, now bye bye. If you have any doubts, guys, please don't hesitate to see, guys. Please try to ping on me here on Telegram only. Omeprazole 40 mg. See, this is the one. This is my Telegram ID. Omeprazole 40 mg. Okay. Please try to message me there if you have any doubts. And also, please try to attend. Please try to attend the. Please try to attend all the quizzes which I am going to post in my Telegram. This is the group here. See here. Oh my goodness, not visible here. Okay, see my group. So now, right now, I'm going to post 150 MCQs in my Telegram group. Okay, we just enjoy it. Okay, bye bye. So that right now I'm going to post. So guys, okay, I will see you on what 10th 10th of this John. Okay, so guys, all the best for your examination. Please study hard. Okay, always believe in yourself, guys. Always believe in yourself. Everything is going to be fine. Okay, always pray to God. Thank you.